Hello, everyone. Thanks for joining us on this AAST Communications Committee interview. My name is Dan Grabeau, and I'm a trauma surgeon at West Virginia University. I'll be speaking with Dr. Arthur Grimes from University of Oklahoma in regards to his paper that he'll be presenting as part of the Quickshot presentations on differences in rate of intervention for blunt splenic injury in adolescents between adult and combination adult pediatric centers. And personally, I know this is a great topic, something that I'm very interested in, what to do with these adolescent patients, especially with splenic injuries. So Dr. Grimes, can you tell us, how did you come up with this idea? What prompted your interest in this topic?
Sure. This topic was a collaborative effort between myself, one of my trauma faculty attendings, and a pediatric fellow at the University of Oklahoma. And we were noticing that there were patients who were in the kind of adolescent age range that maybe looked like adults, and some that were in the same age range that maybe looked more like a child, and but they were being treated similarly. And the question that we had was, is that the way it should be or not? Because of the studies that have been out there evaluating pediatric blunt splenic injuries, and the age groups that were involved didn't really include that adolescent age range as much.
Yeah, that's a common problem that we see at those that are combined centers too. In brief, what did you find when you looked at this TQIP review?
In brief, we broke down age groups from 6 to 12, 13 to 17, and up to the low 20s to kind of compare 3 different age groups and see what interventions they were undergoing at a combination center, adults and pediatrics, versus just adult centers. And we found that the adolescent age range was treated more like adults at the adult centers and more like children at the pediatric centers.
Great. Did anything surprise you when you when we reviewed this TQIP database?
That was mostly what we were expecting. Even though the adolescents are included in pediatric guidelines, we suspected that most centers were treating them more like adults if they were at the adult centers. If they're at the pediatric center, there's a tendency for them to treat them more along pediatric guidelines, but it was still, the intervention rates were still elevated at the combination centers as well.
Great. Do you have any future studies planned based on the results of your initial study here?
We have not move forward with any further studies at our own institution, but we do believe that guidelines for the specific age range of adolescents, maybe in the 13 to 18 range, should be further delineated and clarified. It is hard to know what the physiologic difference is and how they heal from a blunt splenic injury, but that is something that should be evaluated as well.
Great. Well, briefly, we talked about you're a 4th-year resident, and this would have been your first AAST meeting. It would have been great to have you there, and it would have been great to be at the location we all wish we were at right now. Can you tell us what you're looking forward to in maybe future meetings and future involvement with the AAST?
Yes, I was very excited to meet everyone at the meeting. Looking forward to future collaborative efforts, maybe multi-institution studies, getting to know people in the field of trauma and critical care. That'd be very exciting.
Great. Well, Dr. Grimes, congratulations on a great paper. I really look forward to hearing the presentation and future work by you and your group. Thank you so much.
Thank you.